Hello, everybody. This is Optimum Health For All. I'm your host, Prof Odike. Today, we're going to talk about skin health, the care of the skin, and how the specialist of skin diseases others with us today, Professor Bolaji Otike Odibi.
Thank you, sir.
You are welcome to this program,
Thank you, sir.
Optimal Health For All. So, we just allow you to tell us about the basis of skin health. How do we look up our skin?
Okay, sir. That's a very nice and interesting question, sir. Especially since this month marks the Skin Health Month for the whole world. Skin Day was July 8th this year, and we marked it, and the theme was Skin Health for All. So now we would like to talk about the skincare, general skincare rules for people. I will start with skincare for the face, as that is what everybody normally sees the face. There's a normal routine which we would like people to follow, which is to cleanse the face. When we say cleanse the face, we expect you to use a mild cleanser, a mild soap that is not really acidic or doesn't have an alkali pH, so just mild. It's used to wash your face early in the morning. And after using the mild cleanser, we expect you to use a moisturizer, which is a mild emollient, which helps to add oils and fluids to your face, hydrate your face, to make your face more luscious and it's fresher and glowy bit. Then we also expect you to use a sunscreen. A sunscreen is a cream that is used to protect the body against ultraviolet A and ultraviolet B, as well as visible lights, because these are the things that cause hyperpigmentation, darkening of the skin, melasma, and can make people that are prone to skin cancer, like albinos and even other people that are not albinos, more prone to the skin cancer. So you get protected from the harmful effects of the sun when you use a sunscreen. So we advocate for most people to use sunscreen. And if you know you have hyperpigmentation, you have any other skin disease which you are trying to prevent, we advocate that you use a sunscreen 8 o'clock in the morning, 11 o'clock, and also at 3 p.m. And avoid the sun as much as possible between 11 to 3 p.m. because that is the time when the sun rays are higher. Then going to just general skin care, we talk about the kind of soap we want people to use. We want you to use a mild toilet soap. A mild toilet soap is a soap that has a pH of less than 5.5 because the skin has a pH of 5.5. And so we don't like you to use medicated soaps that might reduce the pH of your skin or even make it higher. So medicated soaps are advocated for certain conditions, like when you have scabies, when you have folliculitis, but not as an everyday soap. We would like you to just use a mild soap, like I said, especially in people that have sensitive skin, atopic dermatitis, and other skin conditions that need for you to use a soap that has the same pH as the skin. So when we say use of everyday soap and things like that, we don't want you to use medicated soaps on a daily basis. Just use a mild soap, a mild toilet soap. That's what we advocate for now. Thank you, sir.
Okay, so these are just there.
Skincare.
Looking at, I hope, thank you very much. Now that all these are, things that you do to look, why is it that we don't like medicated? Because most of us, from advice on TV, and so we believe that medicated soap will protect us, kill the germs, body, and make the skin healthy.
The truth of the matter is that the skin already has a protective barrier on its own. And the skin has its power to fight diseases as well, which was already made by nature, making the pH of the skin 5.5. So anything that increases this pH at all will make the skin not as effective in fighting skin diseases as it should. And that is what most of the medicated soaps, they increase the pH of the skin. And so the skin is not able to fight skin diseases as it normally should. So that is why we always advocate for the use of mild toilet soaps that are nearer the pH of the skin, which is 5.5. We also advocate for people that have atopic dermatitis, that is people that have sensitive skin, that they must use soaps that don't smell so much, they scent less, They don't even bubble so much. They don't bubble as much or foam as much. Just like the soaps we advocate for people that have atopic dermatitis, sensitive skin. So we'd rather you use toilet soap, which are mild, and not medicated soaps or other harsh soap that will increase the pH of the skin.
So, medicated soap.
And not for everyday, sir. Yes.
Why is it that we don't like bleaching creams?
Okay, sir. Thank you very much for that question, sir. Bleaching creams, it's like an avalanche of the use of bleaching creams now, both for men, both for women. And we really don't know why. Sometimes we think that maybe people think when you use bleaching cream, you are more attractive, you are more acceptable, it increases your self-esteem. Maybe as a woman, it makes it easier for you to find a man to marry or get a job and things like that. But what we have come to notice is that there are a lot of complications that people come to see the dermatologist for from the use of bleaching creams. First and foremost, it ages people faster. It causes atrophy of the skin, thinning of the skin. It makes your veins of the skin become more visible. You now see people with more visible veins because they are using bleaching creams. You find also that now you tend to have, if you are using things that have hydroquinone, because it's what we call exogenous ophthalmosis, when you have blue and black patches on the face. And so that also ages you and makes you look older faster. It also causes a predisposition to all kinds of bacterial infection. You have more boils, more different kinds of swellings on the body. You have more fungal infection all over the body. And the kind of fungal infection you just have from using a bleaching cream is called senior incognito, because it's now more difficult to recognize. The bleaching cream triggers the fungal infection, so it's difficult for you to even appreciate and know that it's the fungal infection because of the bleaching cream that and it spreads faster, yes, and it's more difficult to treat. You also find that for bleaching cream, you have spread marks. You can even be prone to difficult wound closure because you're using a bleaching cream. You find that even those that use it too much might even have systemic symptoms like Cushing's disease, which they now have become fat, big shoulders, big face, and things like that. Yes, some people can absorb it when they use it so much, and they have been using it for many, many years. Yes, sir. So, yes, sir. So it's now just not only a skin manifestation; it can now be systemic, and it goes into the body. So, exactly, diabetes and things like that. So we really are advocating that the use of bleaching creams should be stopped as much as possible. And people should use sunscreen instead. Because sunscreen will help to maintain your complexion for you. You won't get that if you use a sunscreen. So rather you use a sunscreen than a bleaching cream.
Now, toning and bleaching, they're different.
Now there's really no difference. The truth of the matter is that when people are bleaching, maybe it's a black person like me that wants to get fit, and you say they are bleaching. When someone is already fat, and maybe they want to maintain it or maybe just get lighter, they say they are toning. But it's the same thing that are being used. So it's the same thing that is happening. Bleaching, yes. Toning or, yes, it's the same thing that is happening.
So these are some of the general tips for care of the skin.
Yes, sir.
Now, what are some general tips? Will be some common disease that can come up?
Yes,
sir. These are just cause.
Okay.
And how do we look terrible?
Okay, sir. If common skin disease, I will just talk about a few common diseases that I think people should know, so that when they have the symptoms, they know what they have and know the right place to go and present. I will start with scabies. Scabies is becoming quite common nowadays. Yes, it's quite common. Or some people say sweetie is scratching them too much or things like that. But it's becoming very, very common now. And we really don't know why. Because before, scabies wasn't so common. But now it seems to be coming back all over again. You find out it is in people, in children in secondary schools, in people in their homes, in people in their workplace. And it manifests with rashes, tiny, tiny rashes in the fingers of the hands. Tiny rashes in between the fingers, yes, and around the side of the hands. You find it also with rashes all over the body. In a man, you find rashes in the private parts, on the thigh, on the buttocks. And these rashes can be very, very itchy, especially at night. You find out the patient is itching and itching and itching and can't even sleep because of that. And after a while, these rashes end up leaving black spots all over the body. And what you find is very contagious. So you find that there are other members in the family or at the workplace or associates that will also be itching as well. So if you are itching, yes, it's very contagious. So if you are itching at all and you find out somebody else in your family is itching, or a close friend is itching, or a loved one is itching, your partner is itching, you should check and see a dermatologist or any doctor to find out if you have scabies. So that is one of the common ones I will talk about. I will also talk about pityriasis vesicolor, which the layman calls eczema. You find out that there are a lot of people that have light patches at the back, not common at the back, and sometimes they can be dark patches at the back. It comes a lot from people that sweat a lot, people that use steroid creams, and people that, maybe people that maybe exercise a lot and things like that. They tend to have it at the back, and it's not very nice to look at, so people don't like it. But it's something that tends to always come back, because the things that predispose to it are always big, except you stop the bleaching cream or void cream you are using. But if you are someone that sweats a lot, except you keep on trying to have your back regularly, or someone that, is using some dark thick clothes all the time, you have to reduce and try and change all those lifestyle habits. But it's a simple thing to treat, and you need to look out for it regularly to make sure has not come back again. Yes. That's that. Yes, and shampoos that can be used for it. Yes, sir. We also have senior what we call ringworm, senior purples of the body. It's also a common thing. So if you find any children and adults, for children we tend to have the one of the scalp more, which ciliar capitis, when you see round things, scaly white things on the scalp of the child. It's important to see a dermatologist, because that will not go with a cream. The child has to take tablets or a syrup before it goes. Then for the one of the body, you find ring-like looking visions that can be theoretic and can be very widespread. If, as I said, the person's on a bleaching cream, or the person is immunocompromised, having HIV or having diabetes, more widespread. Yes, sir, and it's more difficult to treat. You also have what we call pityriasis rosei, and that happens a lot during the rainy season now. You find people coming with something that looks like a ringworm on their body first. And after a few weeks, you now find that a lot of rashes have spread around the body, especially the back. And it tends to have what we call the Christmas tree kind of eruption. That is also something like to see a dermatologist for. And we also have many other things, skin diseases coming up right now. It's important that people come to see a dermatologist, or at least see a doctor first that will refer you to a dermatologist when you have a skin problem. Because a lot of them look alike and can be confusing. Yes, sir, they can be very confusing. And it even gets worse when you go for treatment, maybe at a patent medicine store, and they give you a triple action cream. That changes the look of the whole lesion.
They just to add whatever.
Yes, in that bacteria or fungi or steroid, something was catch it. So they will give you the triple action so that something was catched and help to treat the pain. Well, in the end, it doesn't help, sir. It muffles the disease, so it's now more difficult for you to see what is happening and what is wrong, and make it more difficult to treat.
Okay, see, sometimes with this would say, once in a while, could do it.
Yes, sir.
The dentist will say, once in a while, come and see a dentist.
Yes, sir.
I will recommend that once in a while, we'll see.
Yes, sir. It's very good. It's very important.
But
the value, especially for people like albinos that have things called actinic keratosis on their skin that might become malignant if they are not careful. It's good that they come for check-up for us to be looking at these moles on their body. Anybody that has a mole, what we call a patch mark, really the one that is black, sometimes it starts to increase in size. We have what we call the ABCDE that you need to look out for. Check the asymmetry of the lesions, check the borders, check the color, diameter, and the enlargement. Is it changing? So from time to time, if you have moles like that, you have bat marks like that, you have freckles on your face, it's good to come and see the dermatologist. But even if it's yearly, let us look at it for you and see if there's anyone that's changing. Yes, yes, yes. Yes, sir. So if you have any suspicious lesion at all, it's good to come to see the dermatologist for a checkup and becoming regular, so that the changes can be noted and recorded. Photographs can be taken, and it can be followed up from time to time.
So use this with keloids. I want to add a question of keloids are usually very difficult. Sometimes people have applied options of theirs who can't pick up. Most like those have the rough keloid and the globe. So what do we do? And then you're in any development with treatment of keloids.
It's something like that.
I want that keloids.
Okay, keloids are exaggerated growth of scars. Some people feel when you have a scar, you have a wound, we are expected to heal with just a tiny scar that might not even be noticeable. We have hypertrophic ones that might grow, but they are still within the margins of the scar. A keloid is a scar that is heaved up and hypertrophied bigger than the margin of your wound and becomes heaved up with time. With continued pressure, itching of the side, it gets bigger and bigger. Keloids are quite common, and it seems to be even commoner in we with black skin or color. A lot of research has been done to try to reduce the treatments and things that can be done for keloids. First of all, we might tell you stop rubbing it, stop scratching it, because that will increase the growth of the size of the keloid. We give injections. We give intralesional injections that can be steroids, or they can even be cytotoxic drugs that can be used for cancer. We can inject them into the yes, to clean the cells, bring it down. Yes, sir. We also have what we call patches, silicone patches that we can put on the keloid if they are small in size to bring it down. Then you can do cryotherapy, which is fusing of liquid nitrogen over the keloid. Yes, to freeze it and also to give injections. And as you said, we can also do surgery. But we really don't like the prognosis of surgery in many tissues because even after the surgery has been done, you find out that the scan there now grows and becomes even bigger than what was there before. So tell the truth, it's really difficult with keloids. So what we advocate is that once you have a keloid, come for treatment as soon as possible, not before it gets out of hand and it's now very difficult. So that we can give you injections and then bring it down. And then from time to time, if it comes up, use all of the things, we might need to receive injections, maybe do some cryotherapy for you or some other things.
Thank you very much. I think you will call it again because it's just more and more interesting.
Okay.
Thank you very much indeed. Prof, I think we have benefited a lot from a discussion on care of the skin. This is this special month.
Yes, sir.
Bad.
Yes, I'm right.
Thank you very much.
Thank you, sir.
On your sharing. Yes, I will call it a day for today. Thank you very much. It's Optimum Health For All. Bye for now.